I'd like to introduce our Director of Professional Affairs, Dr. Samuel Knapp.
Thank you. Okay, so I just press here. All right. Ooh. Holy cow. Okay. I to make comments about legislative advocacy have been asked. Well, this morning I woke up at 1:30 and I had trouble sleeping because I get worked up about things. I get all upset. And so my wife is used to that happening. And usually when that happens, I just get up and go to work. And so she's used to waking up. And I've been at work for 4 hours already. And by the time she wakes up, it's just easier to work on stuff rather than obsess about it. But this morning what I did is I watched a science fiction movie on Sci-Fi Channel. It's about people who were trapped in an island of zombies. And the heroine was named Rachel, which I thought was very appropriate because we have a heroine named Rachel here. And it was a very frightening kind of thing. But I had to sit back and think, oh, this is not realistic. Zombies don't attack very often in the day. Everyone knows that zombies are more dormant during the day and attack more at night. So I just have to put these things in perspective. They're just not realistic. Well, I'm going to talk about two visions of psychology, and my goal is to help you appreciate the things that we're doing and to motivate you for some of the challenges that we're going to have already. Our strategy for years has been a building block strategy. For every session of the legislature, we try to enact one or two laws that build upon the practice of psychology. Because we're statutorily far behind, there's many things that we can do that because of archaic statutes we're not allowed to do. And for example, a few years ago we got a bill passed that would allow psychologists to evaluate drivers who've been suspected of being impaired. So when the state police see someone driving erratically, they can pull them over, and if they suspect that this person's maybe demented or something, they can order that person to have an evaluation by a psychologist. Now for years it could only be a physician. Now most of you probably did not enter the field of psychology in order to evaluate impaired drivers. You probably didn't say years ago, Mom, I don't know what it is, I just really want to evaluate impaired drivers. Really the reason I'm in this field. But it is one more thing that we can do, and unfortunately this year we're having to play very defensive. And already we've had two setbacks. The Supreme Court has a recommendation, they issued an order saying that parenting coordination is now outlawed in Pennsylvania, and this is something which is very helpful to the courts. Some of the county judges are very upset about it because they've used psychologists effectively as parenting coordinators, and we're working on ways to address that issue. We also had disability services have been privatized. Now that the psychologists will still be contracted to provide these services, but we had a system that's fairly stable, is working well, and we're not exactly sure what the conditions are going to be now that we privatize next year. Psychologists will still be doing it, it's just the conditions may change. Here's a negative vision, things that could happen. And Dave already alluded to child abuse. The Sandusky narrative has been driving the debate about child abuse. So you ask the average legislator, they're like the average person in the public. You ask them about child abuse, well, they start talking about Sandusky. That's what they've heard for the last 2 years in Sandusky. What do they think about child abuse? Oh yes, it's terrible about sexual abuse and how mandated reporters aren't doing their jobs, and because they think of Jerry Sandusky and coaches walking in on children being sodomized and doing nothing, and they hear that over and over again. That's what they're thinking. They don't have a broader perspective. They don't realize that in 1998, a psychologist reported Jerry Sandusky for sexual abuse, and it was unfounded. And this is the pattern, is that we have a very low rate of substantiation of mandated reports in Pennsylvania. It's one of the lowest rates of substantiated reports in the country. And this is the real problem. And so we have to change the narrative. So a lot of the proposals are very draconian against mandated reporters because you didn't realize that you're the problem, according to them. And we have to educate them and say, hold on a second, there's a lot more to this. There's a whole lot more to this than superficial news reports that you read. So one of the proposals is that every 2 years, everyone has to take the same course on child abuse, whether or not you ever treat children or not. That's real smart, isn't it? That you have to report child abuse even if you're in your private life. So if you're in the grocery store and you see a parent who's overly disciplining a child, it doesn't have to be abuse. It just has to be something that you suspect, gee, that might eventually become abuse, or that parent is the kind of person who might eventually abuse someone. Gee, now I have to report that. Yes, this is Sam Knapp, our mandated reporter. There's a woman in a red dress. She's just leaving the wall right now. I can't get the license plate, but she's abusing her child. But I suspect she might be a child abuser. I mean, these are real smart proposals, aren't they? There's a proposal that you lose the ability to initiate an involuntary hospitalization. The proposal that your fees could be determined to be excessive, though that's not really described what excessive is. There's a proposal to privatize psychology in the correctional system, and our state hospital psychologists next, we don't know. Very draconian Medicaid audits, which are very unusual, I'm using that advisedly, interpretations of regulations. I won't go into the details of this, but Medicaid was using some interpretations of regulations, which we have taken care of this, to stop doing this. But if this had not been challenged, our data shows that at about $35 million, psychologists would have to refund about $35 million, and about 150 psychologists would go bankrupt from these audits. Other burdens. Proposal, 6% tax on all psychological services. Physicians were exempted from this. Psychologists weren't. You can only, proposal, you can only supervise psychologists in training. You can't supervise anyone else. New York State passed this law. Anytime you have to report anytime you think a patient might have a predisposition to become dangerous. You have to use the predisposition to dangerousness scale. There's a proposal about child abuse that if you fail to report child abuse, that it is a felony. When I was a real psychologist and treating patients, I worked with a lot of high-risk families, and I made a number of reports of child abuse. There's a couple times I saw kids, maybe seen once or twice, and it turns out someone had reported them for abuse. It was substantiated. That was back in the 1980s when they actually did substantiate child abuse when it happened. And there's no reason, I had no reason to suspect child abuse. If I had seen them longer, I probably would have found out. But under this proposal, I would be a felon. And automatic loss of license. And I'm at this is a quote here, I'm at a hearing, the DA says, I would gladly, proud, very, very proud, misspelled gladly, but Tom pointed that out anyways. Gladly send any mandated reporter to jail for failure to report. I mean, they really want to do that. Reimbursement rates. I won't get into the Medicare reimbursement formula, but if the sustainable growth rate were to go into effect and sequestering it would continue, average rate of psychotherapy for an hour would go from $80 down to $50. Average incomes would drop from $85,000 to $50,000. if psychologists were excluded from accountable care organizations, so nobody knows how much accountable care organization is going to permeate the marketplace. It's just pure speculation. So this is speculation. But this is a worse scenario. 1/3 of psychologists would see their incomes fail, plummet. Fewer students would go into psychology. Who would want to go into psychology if you can't earn a living? And fewer psychology departments, less research. Look at all the stuff we've learned in the last 10 years, 20 years, 30 years, all this positive stuff that's used to help people. And that infrastructure would be greatly eroded. Okay, but fortunately, because of things we've done, a lot of these negative scenarios are not happening. The idea of making felons out of people who fail to report child abuse, that's off the table now. It's not being discussed anymore. Tom has been meeting with the legislators about this issue. It's not an option anymore. They understand, enough of them understand that's not an issue anymore. We're working to get some kind of reasonable child abuse education mandates. There probably will be some kind of mandate for all healthcare professionals on education on child abuse, but it's going to be reasonable, and our proposal is that, as they do in New York State, where they have a mandate that the state boards can exempt people who don't treat children. And if you're a geropsychologist, for example, it would make much more sense for you to take a report on a CE program and reporting elder abuse rather than child abuse. And we stopped some other, pernicious legislation. We stopped the most draconian Medicaid cuts. Are not happening. There are some Medicaid audits. There has been some couple bankruptcies, but it's not the pervasive sweeping the profession that it could have been. We stopped the effort to regulate excessive fees. We've stopped the sustainable growth rate cuts from going into effect. And this summer, we will be, American Psychological Association will be working on a very important effort, and Vince is going to talk about this in more detail, to address the decline in reimbursement rates. And the reality is, when we talk about accountable care organizations, more psychologists are cultivating contacts with primary care physicians, working cooperatively, integrating their practices with healthcare, preparing to move into accountable care organizations. And there's some positive things that are going to happen. There will be health exchanges that will provide coverage for 1 million more Pennsylvanians. It is possible, the governor hasn't decided yet, there may be a Medicaid expansion which will cover another 1 million Pennsylvanians. And these will all include mental health coverage. Health exchanges have to have mental health coverage. There will be commercial policies will have expanded benefits. There will be prevention activities will be covered. Weight loss will be covered. Other preventive activities will be covered. So what is their future going to be? Right now, 90% of psychologists like or strongly like their careers. Just the survey data has been rather consistent for a number of years. And 10 years from now, are we going to still have a profession that we enjoy working in, or is the quality of professional life going to deteriorate? And currently, our data is that psychologists average about $85,000 a year in income. 5 years from now, is that going to plummet, or is it we going to sustain that and maybe increase it a little bit? And so we're going to be working real hard to make that positive vision come true. Thank you.